All right, I think we'll go ahead and get started for the sake of time. I'm sure some other folks will join us as we move along with our presentation, but thank you. You have made it to the Systems for Action Research and Progress webinar series. This is a series that we host every 2 weeks where grantees and researchers from across the country come and present on their research in progress. And when we speak about research for the Systems for Action program, we're talking about research that is focused on system alignment initiatives that align the medical, public health, and social service sectors. So many of our projects across the country have special topic areas and focus areas, but they all have this one thing in common of systems alignment and aligning across all 3 of those systems. If you are not familiar with Systems for Action, and this is perhaps maybe the first Research in Progress webinar that you have attended, we are a National Research Program Office of the Robert Wood Johnson Foundation, and we're housed at the Colorado School of Public Health in Aurora, Colorado. And my name is Carrington Lott. I'm the Deputy Director at Systems for Action, and I have the wonderful privilege of being able to introduce all of our grantees before they present on their research. So today, as you probably know, because you registered, you'll be hearing from a team at Salt Lake Community College, and you're hearing from them for the first time because they were awarded their grant in September 15th. So that was their start date. And this is the first time that they have come to talk about their research plans and project. They are funded for 12 months to do a pilot award looking at the efficacy of holistic admissions in the health sciences education. So you'll hear a lot more about that within the hour. They responded to a CFP that we released in early 2024, looking at systems alignment, of course, and then also had to focus on dismantling systemic racism. And they are specifically focused on, as I mentioned earlier, holistic admissions. So we're really excited to hear from them. Bob, can I get you to go to the next slide, please? So this is our agenda. We're here at the welcome. I'm about to be quiet and hand it over to the research team because that is what you came to hear about today. They are going to introduce themselves in a minute because they can give a better introduction of themselves. Just a little bit of housekeeping before I hand it over. Today's session will be recorded and we'll share the slides and the recording after today's webinar. And if you have any questions, we will reserve time at the end. We'll have about 10 to 15 minutes for Q&A. So if any questions come up along the way, please locate the Q&A box at the bottom of your screen and put your question in there, and we'll make sure that we address it at the end of today's session. I think that is it from me for housekeeping. So Bob, I believe you're the first one that's kicking off the presentation, so I'm going to hand it over to you.
Thanks, Carrington. I won't read through our entire biographies. I'll just introduce the team real quick, and we'll go ahead and get started with our presentation. My name is Bob Pettit. I'm the Dean of Health Sciences at Salt Lake Community College. I'm joined by our Associate Dean and Head of our Nursing Division, Dr. Stephanie Richardson. Sharon Knupp, who is our Director of Health Sciences Admissions, Marketing and Outreach. And Cher has an impressive background with the medical school up at the University of Utah prior to joining us, and is really the architect behind us diving into holistic admissions at Salt Lake Community College. Mindy Bateman, who is our Director of Crossroads Utah Area Health Education Center. She's been in that role for quite a long time and is a valuable community partner and really works with our pipeline to educate students about career paths in healthcare. Matt Harris, who's our director of our radiological technology program. He's been in that role for 6 years and is just about ready to transition to a new role as the associate dean over that entire division, the Division of Health Professions here at Salt Lake Community College. And finally, we're joined by Libby Parr, who is the regional imaging educator for Intermountain Healthcare. They're probably the largest, well, they are the largest provider in our region. And she really has been a wonderful advocate for our program, serves on our policy advocate committee. I probably said that wrong, but program advisory council whatever PAC stands for, she's on that. She's also a preceptor, works with our students clinically, and it takes part in interviewing as part of our holistic admissions, which we'll discuss in a little more detail. And she'll give us some perspective on, is it working? How's it going? So we dove into this topic. I met the head of the Utah Hospital Association, who said, we've been trying to get diversity in healthcare for over 20 years. I'm never going to see it in my lifetime. And I thought, you know what? We can take on that challenge. You're going to change the landscape of and demographics of people in healthcare by who you're releasing into healthcare. And it's going to be people like us that do that. So improvements in diversity and cultural sensitivity in healthcare may be positively impacted by selective admission standards that extend beyond academic criteria. We'll say more about that in a moment. The holistic admissions emerged to level the playing field of marginalized students for high impact programs and really high impact universities. So places like Harvard really set the tone for we're not just going to let people of affluence into our university. And the medical school started doing it, pharmacy, dental, but not really community college. I believe we're probably the first community college to really dive into this. And that's what we're doing. We're studying the efficacy of these techniques. I will say, by way of introduction, holistic admissions is a movement. It's truly organic. It doesn't happen overnight. It takes a team. But as a dean sitting back and watching all the partners and people step up in our community, people that work across our campus, serve as interviewers, it's been truly, truly a blessing. And I can't say enough about how impactful it can be to your program. There's been recent anti-DEI legislation that has inserted some challenges into holistic admissions. So our traditional way of admitting students was two criteria, your GPA and standard testing. We know GPA it has an impact of who gets into your program. And if for us, it was you would walk down the halls and you would see photographs, and they all look the same every year. And I remember talking to one of our program coordinators and say, this is wrong. We have to do something about this. We can't just let the people of affluence, second, third generation students. What about the students that are coming from low socioeconomic statuses, that are first gen students, that are BIPOC? And so we started thinking more about what else can we consider. Then we looked at standardized testing, and Dr. Richardson will remember this because we had a student take this test 3 times and they had a 3.7 GPA. And they're sitting in our meeting, and we were just like, why are we doing this? We read literature that says this test is racially biased. And it was so cool for her to inform the faculty that voted unanimously, let's get rid of the T's. And she told this student, you've been admitted to the nursing program. And her father broke into tears. I mean, it was just utterly, why are we doing this? Let's do something better. And so that's where Cher came in and said, let's get into holistic admissions. Holistic admissions allow you to consider non-academic qualities and characteristics. Characteristics such as compassion, empathy, ethical decision-making, cultural competence, and soft skills. It was originally conceived to improve the diversity gap, but it does far more than that. It's truly an inclusive admissions model, and it is not necessarily going to change this standard. One hidden thing that we've discovered is that it allows you to screen away people who really shouldn't be in healthcare. There's certain people with 4.0 GPAs who you're just thinking, I never want you over my bedside. You have no empathy, you're arrogant, et cetera, et cetera. And it's that so-called 10% that drive up 90% of your time. I'm going to turn it over to Cher.
There are 3 different holistic admissions metrics models that we'll be using. The first is the multiple mini interviews. Those for us are in-person interviews where students come in 1 hour rotations. In that hour time frame, they have 5 ethical scenarios that they will respond to, in which we've determined a domain and specific attributes that we're looking for within that domain. And then students also have a team building concept where they have a role play that is pertinent to the program that is running the interview. We have the situational judgment test. I like to call it the MMI on steroids. This is for programs that perhaps have more students that we're assessing and we don't have the staff or capability to do in-person interviews. This is an online assessment, same type of concept where students have ethical scenarios that they respond to. And we have the standardized video interviews. This is done on a third-party platform. For us, we are using the SVIs as a metric for what used to be standard essays. This will allow us to ask questions to the students that we had in the essays, but also dive a little bit deeper for their intentions in wanting to come to the program and get some more answers for us than things that we would not be looking at within the MMI interviews.
So we do have to be careful that there are both federal and state laws that restrict and put certain rules on admissions. In June of 23, the US Supreme Court ruled that race-conscious admissions was unconstitutional, reversing a rule from 2003, which is more the affirmative action era. Model legislation was drafted by the Claremont Institute, and it came out that the states were going to follow suit. In fact, when we were writing for this S4A proposal, it was with the mindset this is coming, and we should study this because other states are probably in the same boat we are. This is the map of a ticker from the Chronicle of Higher Ed. They're monitoring the anti-DEI legislation that's getting proposed throughout the United States. There's 86 bills that have targeted DEI, 14 that are now in law, and you'll see in green, we're one of the states in Utah. So if we're able to implement holistic admissions here, you can do it anywhere. Share, you're muted.
So research question that we're looking at would be evaluating the psychosymmetric properties and the efficacy of holistic admissions metrics for screening prospective students to competitive health science education programs at a community college. Questions including, do they change the demographics of people admitted, race, socioeconomic status, first gen? Do holistic admissions jeopardize academic performance? Addressing the issue of so-called deficit thinking. Do these processes admit students who possess better cultural competence? Do these students ultimately thrive as clinicians lasting in the field? Our Systems for Action project includes the following partners. In the medical system, our Utah Hospital Association, Utah Health, Intermountain Health, and HCA Mountain Star. Our public health system is Crossroads Utah Area Health Education Center and accrediting bodies, and our social system is our College General Council. The roles of our partners are to serve on our program advisory councils, curriculum admission standards and donors, clinical sites, our preceptors, and also interviewers.
So through a variety of programs and activities, we plan to train pipeline students, both high school and college level, regarding the MMI and SJT process. Part of this process will be to train them on what each test is assessing, including critical thinking skills, communication, ethical decision-making, and cultural competence in healthcare, just to name a few. For the MMI preparation focus, we'll talk about structured practice on common scenarios, helping develop reflective and responsive communication skills. So next slide. with our SJT preparation, again, we'll be training to simulate real-world SJT testing and provide students with tools to help improve these skills. And then after preparation for both activities, we will implement surveys to assess students' confidence in these tests. And so far, through this process, we've been able to provide this training opportunity to 2 different groups of students. We've noticed a level of anxiety that has decreased in students after discussing training, as students have walked away with the knowledge of what to expect with these tests. So that's been exciting to be able to see that anxiety go down. Next slide. And then using a structured rubrics, we will measure students' response to measure the impact and effectiveness of the training. This will help us make changes and develop any quality improvement measures needed to help students be better prepared. Next slide. So currently, Crossroads AHEC has been able to show 71% of the students who work within our programs have been able to continue on in healthcare programs. We will now add additional long-term tracking measures to determine success rates of those who participate in MMI and SJT prep compared to those who did not. We will also be able to, we're also able to determine which programs these students have matriculated into. And knowledge of this will also help us to know if students will have used the MMI, SJT, or both during their application process. Next slide.
Okay, more on our procedures. Those of you on the call that are thinking about implementing this on your campus, it's very important to have all of your information vetted by your legal counsel. Who would think you'd say, I love my lawyer, but she's very good. She's wonderful at looking at things. I've quoted the HB 261 law that went into effect here. And I'll just read it along with you. Discriminatory practices, including assertions that socioeconomic political structures that are inherently a series of power relationships and struggles among racial groups, prohibiting the notion that an individual, by virtue of an individual's personal identity characteristics, bears responsibility for actions committed in the past by other individuals with the same personal identity characteristics. I don't know what journal that came from, but it is what we're dealing with in the state of Utah. So how do we implement this at Salt Lake Community College, our flow? We have our pipeline where we recruit from. They complete an application and then go through an initial screening where the top percentage are included to advance along in our admissions process. So if we have a capacity for 50 students, we'll let in 100 for the next phase. The rest are excluded or disqualified. Many people are just simply don't meet the minimum grades for example, a C or better in anatomy. The second tier of the admissions begins with our holistic admissions, either the MMI, the SJT, or the SVI, and we'll discuss more in detail about those metrics. They're also surveyed on the process. It's important to find out what students liked, didn't like, what interviewers thought went well, didn't go so well. Maybe there was too much of a pause for this question. We didn't really need 5 minutes for that question, and so forth. Those that are selected as alternate return to the queue and either can apply the following semester or in some cases the following year. And then those that are admitted go through background screenings, immunizations, and so forth. And we have a digital infrastructure that supports all of this. We have a software, My Success, that helps us communicate with our pipeline, and the work in Mindy and AHEC, what she does, communicating with prospective students. They complete their application in a software called Enrollment RX that allows us to get more detail about things like demographics, socioeconomic status, and so forth. This is all downloaded, then rank ordered, and then students are scheduled. They can sign up, claim a spot, maybe that something happens, they can change it, and digitally helps us on the back end keep track of who's showing up at what times. Various third-party platforms that we'll mention later, and then some of the metrics with Qualtrics, Compleo, and then our clinical placement softwares.
I'm going to talk a little bit about the multiple mini interview format that we used and the IDI intercultural development inventory training, exactly what those are and how we implemented them in this holistic admissions process. The MMI originated in medical school admissions, and so we've adopted our MMI procedure from these medical school admissions. There are short interview questions, and there's multiple interviewers. So the student goes from room to room and talks with an interviewer for 5 minutes, and the student is presented with an ethical question, a situation where they have to make a decision. Maybe there's no right answer to the situation, but the interviewer can talk with the student for a few minutes and determine if the student is exhibiting compassion or exhibiting kindness or exhibiting trustworthiness and so on. The interviewers all went through this IDI training so that we could reduce bias as much as possible for the process. And then the interviewers sign an NDA so that the applicants don't know the questions that they're going to be asked. Next slide. The procedures for our MMI process are outlined here. With total transparency, we update the website with the admission criteria so that students know that they're going to be experiencing an MMI multiple mini interview application experience. Email blast to the pipeline, and with programs like My Success, students can see this information and know how to prepare for their application to the program. Guest presentations in our intro courses happen from HOSA and AHEC. The faculty, we develop the metrics for the IDI. So the faculty decides what domains we want to use. In other words, what traits are we looking for in the students so that we can assess them on their soft skills and bring in the strongest students possible for our healthcare teams in our region. So the faculty establish the domains or the attributes, if you will, write items if they're doing
Did we lose Matt? The memories of COVID and Zoom. I'll try to chime in a little bit, and if he pops on, I'll let him resume. We have the cultural bias training, which we'll discuss on the next slide here. The MMIs are scheduled, conducted, they're surveyed on their experiences. And then there's some statistics on internal consistency, item analysis of, we want to make sure statistically, if it's a bad question, get rid of it.
That was weird. Can you hear me? I'm back.
Yes, we're moved on to the IDI, Matt. So hop
Yeah,
right there.
the program just crashed and reloaded.
Okay.
Thanks, Bob. Thanks for picking it up as it crashed there. Originally, the IDI was conceived to evaluate Fortune 500 execs and people representing U.S. companies internationally. So the IDI, the Intercultural Development Inventory, has been an excellent way for us to assess the intercultural development of our interviewers, and at least have an internal dialogue for our interviewers for them to look in the mirror and think about their cultural sensitivities and intercultural growth. This is the spectrum that the IDI will place people on once they do this questionnaire, kind of like a personality test, if you will, where you'll answer various questions and then be dropped somewhere on this spectrum. And with the IDI, the Intercultural Development Inventory, also comes a growth plan. So everyone that does the IDI gets a growth plan so that they can advance on this spectrum of intercultural development.
Thanks, man.
The situational judgment test really reflects the same constructs as the MMI, but for nursing, we are a high volume program. So the SJT was selected because it's scalable to our numbers. We admit 120 students to our program every fall, spring, and summer term. So the SJT, which is a lot like a multiple choice exam, is administered online. One of our pain points is ensuring online remote security, because we guard our questions jealously and we want to make sure that the test taker is who they say they are. But we all know about test security. So Bob, next slide, please. The SJT has a long history and started in the military, where they wanted to test for what we think of as the soft skills for leadership and integrity, and in business, where they also were looking for leadership and some people management. The validity and replicability of the SJT is entirely internal, because it's based in the SJT that is in use at the time is taken from the job description that you're looking for. Domains are selected from the job description. So the SJT for the military simply doesn't translate to nursing, for example. And currently, SJTs are used to fill administrative positions. It's important for customer service, and it has been used for quite some time for medical admissions. And in our proposal, as you'll see from the 2 test questions I've included, the STEM questions really are very low fidelity simulation scenarios, and there are multiple options that the test taker can choose from. And the test taker is presented with 30 of these low fidelity scenarios. We present these to all completed applicants, and we're going to compare their scores to working nurses with their license. Next slide, please, Bob. The domains are important, and you construct your SJT based on the domains that are important to you. So for business examples, you're looking for innovation, adaptability, and leadership. In schools of medicine, you're looking for empathy, integrity, and resiliency. And in our proposal, we are looking at the CUSIN competencies, and that's quality and safety in nursing education. And you see the 6 CUSIN competencies, and we did kind of a mashup of 4 of those. I'm not going to tell you what we came up with, because we want to test them out and don't wish to leak them right now. Next slide, please. But the foil for the SJT that we're using for our questions, that we ask the student to decide which of the potential answers would be very ineffective, or merely ineffective, or effective, and then most effective, where this response would significantly improve the situation. And that's how we key the responses. Next slide, please, Bob. Here's an example of the SJT item in something that I'm calling the technology domain. And while viewing a classmate's social media profile, you notice that your classmate has made negative comments about treating a recent patient. Your classmate describes the patient and the patient's condition in detail, which violates patient privacy regulations. And there you see 5 different possible answers that the respondent can choose, and they are forced to order or select the efficacy of all 5 of those. At the very bottom, you see the key responses, and you're looking for a high score here. So A4 is the highest. Yeah, you can roller skate through those, Bob, if you want. But the next proposed item, it is a case where you, and it's in the leadership domain, you and a classmate stay late after class one day to ask the TA some questions about an assignment. And while the 3 of you are talking, the TA teases your classmate about their ethnic background, saying your classmate is a smart kid who probably has overbearing and pushy parents, and you see from your classmates' face there at them, and they walk out of the room. And here again, you see the 5 possible answers, and then you see the key at the bottom, and E would be the one that's probably the most effective, but B also could be quite effective, and so on. And next slide, please, Bob. And here are our procedures. So we plan to let them know right up front they'll be taking an SJT, and our faculty developed the SJT, talked about the domains, they wrote the items, and I'll just take a moment to say that was very difficult, and the foils and the ratings. And we had the SJT reviewed by our legal counsel. We are coordinating with the testing center and securing the software company for remote testing. We are establishing the window for testing, and then we're going to conduct our student experience and survey the students. We'll have the SJT evaluated. We're going to do the usual item analysis for internal consistency, and then we'll inform, we'll look at the results. And I'm done. Bob?
Thank you, Stephanie.
Mhm.
What about the standard video interview? This really replaces the self-report or autobiographic narratives. It's important, we're using a third party. It's important to budget time for things like standardizing your dashboard. That takes about 60 days per the company's rules. You have to budget time for your instructional technology people. They were asking questions like, does it have multiple sign-ons and security of that nature? And then finally, your financial processes, setting up accounts index, all these things that take time that you have to budget for. A little bit on statistical analysis. Most of our statistics are pretty basic. We'll be comparing those that were admitted versus those that were not. This is some pilot data from last year with our radiological technology technician program. Here it's the same data. This is the frequency scores. Right panel looking at the MMI, those that were admitted in blue. You can see the central tendencies, their mean is significantly higher. More importantly is the composite score. If we look to the left panel, the total score, these are all the things that are rated for the individuals. And you can see there's a lot of value added to the MMI portion. And mind you, what Matt had said, the MMI, these interviewers are your stakeholders. They're not faculty members. So when students challenge, hey, why didn't I get into the RadTech program? Well, us as the faculty, we didn't evaluate you up here, and a professional in the industry came up with your rating.
It's important to gather student testimonials. I was interested in the pilot process, how students would respond. I was there just kind of making sure things were running smoothly, and I talked with them after their process to get what their thoughts were. But I was interested to see if those responses would be the same once the survey was sent out and they were anonymous responses. They actually were, believe it or not. So some of the responses that we got back from the survey were, I feel like I am being heard. If it were up to my GPA only, I would never get admitted. I applied twice before and finally got in. Thank you. Honestly, I thought the process was great. That was my first time doing an interview in that manner, and it was so much more relaxed feeling than your typical interview. I felt very comfortable and more confident during this interview instead of a traditional interview. I'm grateful for the opportunity you've given me. Passing on to the interview phase was nerve-wracking, but I found the MMI format to be well structured. It allowed me to showcase my true self comfortably, and I appreciate how organized and straightforward the entire process was. I loved it. It was interesting to respond to these situations, and I loved this interview process. So in summary, holistic admissions allow for considering non-academic attributes and characteristics. From a legal viewpoint, holistic admissions are best described inclusive. Essays, SVIs, SJTs, and MMIs have emerged as popular holistic admissions techniques. Always safeguard your metrics and describe holistic admissions to prospective students. We do this through informing on our websites. We teach the advisors what the different metrics are we're going to be using. We're currently working on podcasts that will thoroughly describe each metric that we're utilizing that students can listen to, and creating a series of videos that can help aid students in how to prepare for these metrics.
Okay, so now we would like to invite Libby Parr to our conversation. Libby, remember, is our community partner, is in the a leader in the radiological technology field. Libby, are you online?
Yes, I am. Can you hear me okay?
Perfect.
Okay, perfect. So this was my first experience with this new way of interviewing, and it was a really fun experience and a really great opportunity to be a part of. So I am grateful for Salt Lake Community College for inviting me to be a part of this great opportunity. There's other radiology schools in the state that I also participate in that haven't moved to this way of interviewing, and I found it really interesting and exciting to be a part of. So this first slide, how it says formerly students were admitted to the RadTech program based on grade point average and scoring on the application essay. The reason why the holistic admissions is a game changer, because like Bob said earlier, a lot of times we have students with really high GPAs who just don't click with the actual soft skills that it takes to participate with patient care, to communicate, and to transfer their skills over into the healthcare industry. So this was a really fun way to change up the interview process and to really be able to test their soft skills. My experience in participating in these mini interviews was I was put in a room, and a question that I was assigned to was given to me, and it was also placed on the outside of the door. So the students, I would hear a bell on the outside, and I could hear movement outside my door, and I knew a student was out there reading the question and pondering their answers. They had a minute or two, I can't remember the exact number, to gather their thoughts and think about what they wanted to say. And then when they did come into the room, they sat down and they discussed how they felt about the scenario that they were presented with outside my door. It was immediately clear some people who have better communication skills than others. I was instructed to really be, non-judgmental, to just take into consideration everything that the student was saying without taking in any personal bias. I found this really interesting on a personal level for me because I had just finished my master's thesis, which I had done on cultural competency in the medical imaging. And so I found this really fascinating to immediately put that into play with these interviews and try and not have any bias and just listen to the candidate and what they had to say. And also, some of them, like I said, were better than the others at communicating that, but really trying to listen to what they were trying to get across in their message, whether they stumbled a little bit or not, but really to pay attention to what their answer was and not so much of how well they presented it, because not all of us are great at presenting. And I feel like I am one of those people included. So, Bob mentioned how sometimes we found there was longer time than others for some questions. Some students went right up to the maximum time that they had, but the majority of the students didn't. I would say the majority of the students were done with their answers in about a minute or less. And then there was some awkward time of just sitting there where I really wanted to communicate with them, but felt like I had to keep it with non-biased. Because if I start talking to people, I start chatting up, and then I learn about their personal lives. And that was something that we really just didn't want to, encourage, so that I didn't take that into consideration. Some people gave personal information in their answers, which was really great. They story told in their answers, and that, you got to learn a little bit about them in that way. But I was really cautious not to prompt any questions and gain any personal information that might sway me one way or another. So that was something we discussed, though, and that is something that's easily manageable and flexible, and we can work on in the future about the time constraints and things like that. So it really wasn't that much of an issue. The third question, do you think your involvement in the multiple mini interviews adds value to screening the types of candidates admitted to the RADTech program? I really do. I've often said that in the day that I was taking and interviewing to the RADTech program 20 years ago, which seems like forever, if it had just been GPA based only, I really don't think I would have even gotten into the program myself. I had a decent GPA, but these kids are coming in with 4.0s, all of them. And that is a really hard area to just make your admission basis off of. Obviously they have to have it at the beginning to streamline some people down that pipeline and to be able to filter out. But I love that this mini interviews added their soft skills. It added their quick thinking. Oftentimes in the medical field, it is a lot about quick thinking and what you're going to do in the moment. And so you really got to see how they could work on their toes. And you really got to see how just mature some people were in their answers and their communication skills as well. So fourth, being a preceptor at SLIT's RADTech student at Intermountain Health, have you noticed any differences in the performance of our students in the clinical setting? So this is our first class of students that we admitted in the fall with the holistic admission, and they are a fantastic class. They are just so ready and prepared for this program. I love the holistic admissions. I thought that was a fantastic change. And I don't know if that accredits to everything, because these kids are they're smart kids and they're well prepared. And the Salt Lake Community College admissions really prepares them before they even get into the program. I think that this holistic admissions is just another positive step in that right direction of preparing them for this program, which is really demanding and very hard on them, and it's very competitive. So I just think it's another wonderful advancement in moving in that direction.
Thank you, Libby. And thank you all for chiming in. I will probably invite Carrington back on if
Yes.
they're-
The next slide, which thank you for sharing your email. That will be in the follow-up slides that we send. So if anyone has any questions for you that come up after today's session, they can reach out to you. Thank you for coming and presenting on what this next year will look like for you and all the work that you've done leading up to it. And thank you, Libby, for providing that commentary. I really appreciate it. And as we mentioned at the beginning, this is a research in progress webinar series. So our grantees and researchers come and present at the beginning of their project, and they will also present at the end of their project. So you can hear about all of the progress that they've made. And we definitely invite you to join us in a year's time to hear about what's going on and what they've learned. So I'm going to kick us off with some questions that have come in. If anybody else has questions, it looks like we do have 15 minutes. And I think we have time to answer quite a few. So go ahead and put yours in. I do see that some have been typed out. So I'm going to re-ask those out loud just for everyone else so they can hear the responses, if that's okay with everyone. The first question, and this kind of touches on something that Libby was talking about, I believe, but the bias of interviewers. And somebody asked, I'd love to hear more about the efficacy of the training for the interviewers Is there evidence that it reduces bias, and on what dimensions? And Matt, I think you had a great response in your answer. So if you would want to come on and talk a little bit about that, that would be great.
Sure. So the interviewers all completed a bias training, which we created. This training is an education on common forms of bias that can exist. So the interviewers could be informed of those types of bias that could be creeping in. They also completed the IDI, the Intercultural Development Inventory, with a debriefing where they talked with a IDI administrator, and then also the growth plan. A good question about how do you assess, right, if it has reduced bias. One method that, at least for me, that helps me feel like, among all these other reasons why holistic admissions is important in healthcare and assessing soft skills is important, is seeing some of those 4.0 students drop down, and some of the 3.7, 3.6, 3.8 GPA students bump up after the interview. So to see some balance of the GPA with the hard skills and soft skills there is some evidence that I've seen that bias has been reduced through this process. And if anyone else has any other evidence, feel free to chime in. Yeah, great question.
We're going to run correlations on that data once we have more people take the IDI plus our situational judgment test and MMI.
Great,
So
thank you.
we're at the front end of this.
I can chime in a little bit about taking that test. So that was sent to me before I came to do the interviews from Salt Lake Community College, and I went in and I answered the questions. And you really learn a lot about yourself when answering these questions. Sometimes you're like, well, is this what they want to hear? Is this how I truly feel? And you start to maybe even second guess it a little bit, but try and just be as honest as you can. And sometimes I was not sure if, like, how I honestly felt. I was like, I can see how this might be positive or negative of how I feel, so sometimes I wasn't even sure if this would be a right answer or a wrong answer, but it was how I felt. Like, because sometimes you can think, I feel like this is how I feel, but it also seems like the right answer. But there were many questions where I'm like, I'm not even sure if how I feel is the right answer or the wrong answer. So you just got to be honest and say how you feel, and it takes that into evaluation. And then we met afterwards and discussed the results, and we're given ways that we can improve, and some I can't think of words right now, I'm sorry. And some resources, that's the word I was looking for, of how I can improve in certain areas or in others. So if you think you're just going to go in and think, oh, I know what they want to hear, I'll click this, it will, that's not quite how it works. So it's really interesting and very an interesting discovery on my own, like cultural competency.
Thank you, Libby. That's helpful context to have. And it sounds like from the interviews that you were participating in, that you took that to heart and really were thinking about how to not be biased in those interviews. I'm going to move on to another question that came in that was answered. And Kristen, I don't think you've come on to speak yet, but I'm going to ask if you can talk a little bit about the answer that you provided. But Victor asked what the identities of the students are. And so you kind of provided a little bit of baseline information about the demographics of the students, and maybe you can talk a little bit about how that might change over the pilot.
Sure, and I think Cher might actually have some updated stats on just the initial couple runs. So this is a new pilot, right? So that was the original data was that a lot of our students are first gen low income students. So almost 70% of our health science admitted students fall into that category, but lags far behind the diversity, racial and ethnic diversity of our college as a whole. And so I know that's been the big push behind this, right, is to try to change some of that and get those highly qualified students into the pipeline. So I'm not sure if we have some pilot data from the first couple cohorts yet, or if this is something that we'll be able to have more information about that later. I don't know, Cher or Bob, if you guys have something. We have information, not truly specifically with rad tech, but in some of the stuff that we did for dental hygiene. Dental hygiene was very traditionally a specific type of cohort, and we knew that we needed to make those changes. And so although they did not take on the MMI this year, they did take on additional holistic components in being able to show us who they were as a person in different volunteer activities and work experiences or patient care experience. And just in making those changes, we saw a 17% shift in the cohort, and the cohort looked a lot different going into it. So right out of the gate, we saw a change in being able to give students the ability to show us more of who they are as a person and what skills they encompass.
Thank you, Chair. Bob, did you have anything that you wanted to add, or should we move on to the next question?
Yeah, go ahead and move on.
Okay, great. Stephanie, I think you answered this one that came in, but Victor also asked about the positionality of the research team, because the literature supports that there is importance of diversity in various aspects in the evaluators of admissions. Do you want to speak a little bit to give more context to the answer that you provided?
Yeah, to the whole group, I can speak for nurses, and the Utah nurses in particular, we're very white, and that reflects the nursing demographics nationally, and it is a direct consequence of decades, and I mean decades, of racial inequality in the profession, particularly when nursing education moved into universities, that sequestered BIPOC nursing candidates into CNA and LPN programs and associate's degree programs. And those candidates were not able to or encouraged to move into baccalaureate, master's, and PhD programs. And so the number of nurses with graduate degrees, particularly PhD degrees, remains very small, because it's like turning around a cruise ship. It takes a long time to change those statistics and to educate PhD prepared nurses. And so here I am, and I'm the PhD prepared nurse, and there's not a lot of me. And those who are like me, we are white. And this proposal is a direct response to that recognized disparity in nursing. And we're determined to change that, starting with our program.
Thank you, Stephanie.
Sure.
I'm going to move on to another question that came in from Victor about the intentionality to reach out to diverse groups of interviewers, so your recruitment process. Does anyone want to take that question on?
So the question is, did we reach out to a diverse group of interviewers?
Right.
I was reading another question as you said that. We reached out to our community, the Rad Tech Program Advisory Committee, so all the people that are on that council, and said whoever wants to participate, come join. We didn't intentionally reach out to diverse interviewers, no, just to the community around us.
Thank you. Another question from Victor about the research team, if you sought counsel from individuals outside of the team that had lived experience which aligned to educational, financial, and cultural marginalization.
Yeah, at the start of this process, we went and chatted with Candida. What was her role at that time? Went down and talked with her, and she was part of the cultural sensitivity group at the school, and we were just touching base with her and asking, how she felt about the process and if this would be helpful. got some good feedback there from her and her group.
Yes, I do remember that. We did they call it an equity compass, and you use it to evaluate your processes with the diversity lens in line. And that's one of the things that was outlawed. We're not allowed to do that anymore.
Yeah, that's one of the tricky things that I think Bob's team has made a really concerted effort, right, to make sure that we're following the law, and a lot of this new law that's been implemented doesn't allow us to conduct specific outreach to racial or ethnic minorities for hiring. That's not legal in our state right now. So I know that he's been working also closely with our HSI director. So we're an emerging Hispanic serving institution, and we do have Kino Hurtado, who's our college's HSI director, right? And discussing with him. Mindy also works with a couple of student teams, right? So Mindy, I'm not sure if you can talk. I can't remember the names of your student cohorts, and Cher, I think both of you are advisors in that team, right? Specifically conducting outreach to future healthcare professionals, right, who are coming from a Hispanic and Latin background.
Thank you. Yeah, I think these are important conversations to keep having, because I don't see that political issue resolving anytime soon, unfortunately. And so I think there are going to be many people across the country, and especially in those more red states, who are going to be facing similar issues. So these are really important conversations, and you're doing hard work and having to navigate those barriers. I think we have time for one more question before we close out today. And the two questions that we don't have time to get to, I will send to the research team, and perhaps they'll follow up with you outside of today's webinar. The last question I'm going to ask is from Erin Ham. If someone wanted to convince a med program to move to this type of admissions, how do you recommend a person approach their admissions team and school to make these changes? Where do you begin the process? If you can answer that in the 3 minutes we have left. I'm sure that took lots of work.
I think, Jerry, you should field that one.
I can go ahead and answer this for you, because I was in the very beginning of the holistic admissions movement at the University of Utah School of Medicine. When I first came in, they did not have holistic admissions. And within the first year, we had a dean come in, and based on different things that were going on with the political climate of Utah, he said, okay, we have to shift to holistic admissions, and this is what we're going to do. We had to do a lot of explaining to our different interviewers and the different people that we were working with, because they had been accustomed to traditional interviews. And what it really is it's explaining that in the process of holistic admissions, you're looking at the person as a whole person. A lot of people have fears that you're going to see GPAs drop, you're going to have different issues. The reality is that you may see the GPA drop just a little bit, but your success rate is so much better. And you're providing the community with the positive healthcare partners that have the soft skills, that have the compassion, that have all of these different things. Even just in trying to bring this on board with the School of Health Sciences and programs who are very set in their ways, and I don't want to make change. Change is scary. Why should we do this? It took a lot of hard conversations with a lot of people, each program one by one, even with Bob, to just say, Bob, this is the what's and the whys of how we do this, but what we can do is we can provide the best healthcare providers out there. This is how we do it. This is what it looks like. It's a lot of work. It's a lot of conversations. But I think if you present it from the aspect of looking at the person as a whole person, and what can that person offer outside of just academic metrics, that's where you can be successful in selling it to a program.
Thank you,
And
Cher.
there's a lot of articles by a scholar named EVA. He's published a lot of work on how to implement this in medical schools.
Bob, if you want to share any of those papers with us, we can send those in the follow-up email.
Or a bibliography, I can do that.
Sure, that would be great.
Yeah.
Well, we are right at time, so I think we're going to go ahead and close out today. But thank you so much for coming and listening into this research team's plans and learning alongside of us. And we will definitely keep you updated as the project moves forward, and invite you to future research and progress webinars. And this is an ongoing series. We have another one, I think, in 2 weeks. We'll send it in the follow-up email along with the slides, recording, and perhaps a bibliography from Bob if we get it. So thank you again today for joining today, and we will see you soon.